Yeah.
That's a very important point you make, that it's not, we've heard from other NGOs as well, that the South has also been hit. You are the chief surgeon for the ICRC, Tom, at the European Gaza Hospital. Talk to us about the injuries that you've been seeing, in particular on children.
Yeah, I mean, it's both heartbreaking and devastating because there are a lot of children, including very young. I think the youngest we've had with burn injuries is a baby of 4 months. Lots of children in the sort of 2-3 age group, but, all ages, many with quite extensive burn injuries. But not just those, also with fractures, with big wounds. I mean, today I've just finished operating on a 13-year-old who had shrapnel wounds to the head and a big open wound on the back of his head with bone that was just floating in it down to exposed brain, and you have to clean all this up and then do plastic surgery basically to cover the defects and stuff. And this is a 13-year-old child, and as I say, the burns are very difficult to treat because under normal circumstances, a deep burn requires surgery to get the best result. But to do that surgery, ideally you need blood to give the patients because they bleed or not. You need certain bits of equipment that we don't have to make that surgery more efficient. So at the moment, it's those who have the slightly less deep burns that have a chance of survival, and we have managed to even discharge a couple that have now healed. But the number of patients that are going to end up, particularly children with long-term significant disability, whether that's amputation or extensive scarring, burn contractures, is going to be a very significant number. And that, of course, is just talking about those that are injured. Obviously, there's been huge numbers, unfortunately, that have been killed as well.
I mean, 4 months, it's incredibly hard to wrap your head around that. And like you said, those with deep burns, what would you do? I mean, what kind of medication? How can you help them? What do you say to the parents here, Tom?
Well, it's very difficult. I mean, it's going back to the way burns were managed in 50, 60 years ago, where they were treated more just with dressings and were in hospital for months. Undergoing lots of painful dressing changes, waiting for the wound slowly to heal. There's unfortunately already because of the overcrowding and burns are very prone to infection. Yeah. We've seen patients with maggots in their wounds. There's lots of flies around. We have to go back to very, very basic stuff, which is trying to do these dressings. Now, again, ideally, these would be done in more, let's say, hygienic, more sterile conditions, with more painkillers, with more appropriate types of dressings. That's just not feasible with the numbers here and the lack of resources. We have to do quite basic stuff in the hope that, we just have to try and treat as many as we can the best way we can, but it is very, very difficult.